Dr. Sherm Silber joins us now because we want to talk about the issue of infertility, and it was an issue with our piece you just saw. Infertility Center of America, and Dr. Silber has written a book as well, How to Get Pregnant. Dr. Silber and I have known each other for over a decade, so it's always good to talk to you, and welcome to Great Day St. Louis.
It's great to see you again, and glad to be here.
Infertility is a growing problem. You even call it an epidemic, don't you?
It really is a worldwide epidemic in every developed country. It's because people are putting off childbearing till they're older, and I'm not criticizing it. That's a social advance, really. But because of that, they don't realize that their ovaries get older faster than they think. So 20% of women by the time they're 30 are infertile and need some sort of medical help. It's related to the age of the egg.
And let's be clear about this. Men make sperm constantly.
Hundreds of millions of sperm a day. You know, my joke about that is that's why we're always feeling so tired. But as we said,
just effortlessly,
until we're 90 years old, we're making 100 million sperm
which explains
a day.
Tony Randall.
Yeah, exactly,
yes.
Right.
Meanwhile, women, the eggs we are born with is all we're ever going to have, correct?
All you're ever going to have. And 1,000 of them die every month.
My.
And you get about 400 ovulations, and that's it. And then you run out of eggs. And some women start with less eggs than others, and they're going to become infertile at an earlier age than women that start with a lot of eggs.
Well, you know, we cannot go much further without talking about Nadia Suleiman, and I'm losing my mic back here, sorry, Dr. Silber, and her birth of 8 babies. Obviously not very common. Ethical, unethical, what's your position on that?
Well, clearly it was a medical malpractice. You know, with IVF, you should be able to safely guard against that. I mean, that problem should only occur with infertility drugs that aren't controlled by doing IVF. With IVF, you can limit the number of embryos you transfer to 2 or 3. And so you shouldn't be having octuplets. IVF should be safer than regular fertility treatment.
And not as haphazard as this appears to be.
Yeah, he just put in way too many embryos. But people must know the patients put pressure on these doctors to do it because in vitro fertilization is not covered by most insurance.
It's expensive.
Very expensive, and so women, and husbands might save up for 4 years to have their one IVF cycle, and they pressure their doctor into putting in more embryos than are safe, and he's got to not respond to that pressure.
So when a patient comes to you, do they have to have been trying, should they have been trying for a set amount of time before you will even see them?
Well, I'm happy to see them at any time if they're just worried. But normally the rule is you don't think about fertility treatment until they've been trying successfully on their own for at least a year. Now, that rule wouldn't apply if they're 38 or 39 or 40, because at that age, every woman has such a high risk of being infertile, and every year she waits, her pregnancy rate, even with IVF, goes down.
And go ahead.
Well, we can avoid these multiple pregnancies and not hurt their chance of pregnancy if you have just a perfect embryo freezing method. So you could transfer 1 or 2 or 3 embryos and freeze the extras and not hurt her chances for pregnancy if you have a really good freezing method. But this doctor in LA obviously didn't.
And we mentioned in vitro. That is one method. The shots that our guest you just saw, she received shots. That is a different method.
Well, the shots precede in vitro.
Okay.
And the point is, if you just do the shots and then intra-unit insemination or just timed intercourse, then there's an uncontrolled number of ovulations. That's the risk. With in vitro, after those shots, before you ovulate, you retrieve those eggs, fertilize them, and then you have complete control over how many you replace.
And it is an emotional roller coaster.
You know, these patients are more emotional than cancer patients or heart patients. Every doctor in this will tell you it seems like the need, the desire to have children at some point in your life. In the modern world, it may not hit you in your 20s, but sooner or later it does. And that need is so powerful, we are dealing with overwhelming roller coaster emotions, much more than when I used to deal with kidney failure, kidney transplant patient years ago, or cancer patients. They have a relatively easy time of it compared to the infertile couple.
Well, Dr. Silber, thank you again for joining us on Great Day St. Louis. His book is called How to Get Pregnant. Thank you so much.